tolerance, Mary, or anybody listening, but just control it. All right. And then the third thing is you got to start focusing on digestive health. As long as you got stuff coming in, and it sounds like you do, stuff coming into your blood through the digestive tract that's causing a problem, and you'll know it by digestive symptoms, it's going to be very difficult to reverse the osteoporosis or control the heart rhythm.
Right. But my concern was, I know that rotten teeth and bad gums can damage your heart. That I know.
It's a circle. The heart damages, your heart problems and your internal problems cause the problems with the gums and the teeth, and then that feeds back in a circle and causes heart problems. So you got to, that's why you got.
So I'm concerned. I've been trying to save these teeth because the abscesses don't bother me. Apparently I'm controlling them fairly well. But if I should have them pulled, I should have them pulled rather than damaged.
Well, I can't tell you about having them pulled, but I can tell you that you're falling apart and your body's melting. You ever see The Wizard of Oz? Have you seen The Wizard of Oz, Mary? Remember the end of The Wizard of Oz, what the witch says? She goes, I'm melting! And she turns into a puddle. That's you, Mary. Now, I'm trying to stop that for you, though. I'm trying to stop that procedure.
Well, in your opinion, would the abscesses be the same as having the rotten teeth?
Yes, abscesses are a sign of infection. It's a sign that tissue's breaking down. And I don't mean to be gross here, but I'm just going to be frank. It's a sign that tissue's rotting and bacteria are starting to digest it. You're basically dissolving. We got to stop this. This is not good.
I'm literally melting.
You're melting. You're melting. But I'm not saying that to insult you or to be mean.
Know that.
I'm saying that because we want to fix it. So first thing you do, you're deep breathing. Your second thing you do, you stabilize the blood sugar, get on the sweeties, make sure you're eating more protein and more coconut oil every time you want bread and pasta and fruit. Try to steer yourself into protein and coconut oil and butter, and then get on the Healthy Start Pack. Do a food diary. Start to focus on which foods are causing you problems. Get on the Biolumin Nightly Essence. Get on your Ultimate Enzymes. Do apple cider vinegar after all your meals. All of the things that you would be doing if you were, say, an athlete or if you were a bodybuilder. That's exactly.
How much protein would you say a person?
There's no how much. You want to go by. It doesn't really work that way. And anybody who tells you how much grams per pound of body weight isn't really giving you the straight scoop. Everybody's going to be different. For you, you're going to need more protein than somebody who's not breaking down because your body has to recover. However, if you're not absorbing or digesting your protein, you can cause more harm than good. And here's another thing about protein, as important as protein is. If you're not working out and you're not stimulating the growth of tissue, that protein is going to go onto your butt and get turned into fat and sit on your butt. So you can get fat by sitting there and eating a lot of protein. Everybody who's doing this, the paleo diet, the high protein diet, as far as protein, protein's great stuff. It's very, very important. But if you're not using the protein, if your body's not turning that protein into muscle, it's going to end up sitting around like fat. So, you can't just eat protein. You got to do some building work. So in addition to making sure you're getting enough protein, you want to absorb it. So you do your protein with your Ultimate Enzymes and your apple cider vinegar. And get yourself in the gym or do some resistance training at home with a rubber band. Do something that'll build muscle so your body is using that protein. So you're going into what we call anabolic or building mode. Lots of things you could do there, though, Mary. What I can tell you for sure is you don't have a medical problem. You have a lifestyle problem.
Oh, I know that.
Good deal. Through deep breathing.
I have a doctor problem.
Pretty much.
They're
not going to be able to help you, and I don't want to rip on doctors. But
they didn't help me for years, and I think they're what put me in this position. But anyhow.
Could very well be. So anyway, I'm going to move on, Mary, because I got a bunch of calls here.
Thank you. Bye-bye.
Take care. Deep breathing, control your sugar, take care of your digestive system, make sure you got enough protein, and then some anabolic or resistance training to build up muscle. All right, RC in California. What's up, my friend? How you doing, buddy? RC. Yes, what's up, bro? How you doing, man?
Hey, can you mix ascorbyl palmitate in powder form in capsules with moisturizing lotion?
No, ascorbyl palmitate, and you're cutting out there, RC, but I heard you say, and correct me if I'm wrong, ascorbyl palmitate, make your own break open an ascorbyl palmitate capsule and put it in a moisturizing lotion. Is that what you're talking about?
Yeah.
No, ascorbyl palmitate, and there's a reason why you don't see ascorbyl palmitate in very many products, although if you go to My Truth products, you'll find omega-6 healing cream made with a bunch of ascorbyl palmitate. Ascorbyl palmitate is very difficult to work with. It's inert. it's stiff. It's like a rock. It doesn't do anything until it's broken down. Now, you can break it down through some creative chemistry, which is how I did it with my omega-6 healing cream, but it won't break down just by adding it to a moisturizing cream. You're not going to get very much benefit from it, which is why you got to buy my omega-6 healing cream, because I figured it out for you.
So
and that's on Truth. Pretty much. You're not going to see more than 1% or so, even less, 0.5% ascorbyl palmitate in very many topical products. If you use my Truth Treatment product, you'll get 12% ascorbyl palmitate, because I'm a chemist. I figured it out quite a few years ago, actually. And so you can use that. Or if you want to make your own fatty vitamin C, you might try mixing. It's still not going to work very well. I was going to say mix your ascorbyl palmitate in some straight oil, but it's still not going to work. Ascorbyl palmitate is just very, very stiff and solid. It doesn't react very effectively. So you have to go to truthtreatments.com and check out the omega-6 healing cream. That's 12% ascorbyl palmitate. Thanks for your call, RC. Appreciate it. Let's see. Mary in Washington, welcome to the bright side. What's up? Mary. Going once.
Hi.
Hey, Mary. What's up?
I'm here.
Hey.
A couple of weeks ago, I started to have low right abdominal pain.
Okay.
I just kind of manned up and dealt with it, figured it was gas, something I ate.
Okay.
But it ended up being I had a CT scan. She was worried it was the appendix.
Okay.
I have a avocado-sized ovarian cyst. I've had a partial hysterectomy.
Oh, my goodness. You just have one, or you have multiple cysts?
I have one, but it
Wow.
has actually a crease in it, so it looks like two.
Okay.
I have not had an ultrasound yet.
Well, here's the thing. You got two words to know when you have cysts. The first word is estrogen, and the second word is sugar or insulin. And those are the two elements that you want to control. Anytime there's growths, cysts or fibroids or skin tags, anytime cells are dividing rapidly, endometriosis, for example, anytime you have cells dividing rapidly or growths, you want to think about estrogen and you want to think about insulin. Now, when I say think about estrogen, I'm talking about how the body processes estrogen, and that usually means a digestive issue. Estrogen is a fatty substance, a fatty hormone, and it gets broken down into many, many different types of estrogen. So you have three main estrogens, and they all get broken down into junior estrogens or types of estrogens. And these breakdown products, the ratios and their proportions are very complicated, and when they get thrown off, that's one of the ways that cysts develop in fibroids and endometriosis. It sounds like if you had a hysterectomy that you have a history that way. Get yourself on the Biolumin Nightly Essence #1, 3 capsules in the morning, 3 capsules at night. Use the Healthy Start Pack. I'd be doing 9 essential fatty acid capsules. Focus on fat metabolism and fat absorption, and then treat yourself like a pre-diabetic or a diabetic. Use the Sweeties product and start to stabilize or at least minimize your intake of fast-burning sugars and carbohydrates and fruits. And then, of course, the whole Healthy Start Pack. That goes without saying. You might also want to throw in the Ultimate Enzymes and the Ultimate Selenium, which has anti-estrogen or estrogen protection properties. So many things you could do. All right, that's all the time we have for today. Thanks for listening, friends. Tomorrow we'll continue talking skin, and we'll talk a little Biolumin Nightly Essence with the formulator and manufacturer. Thanks for listening. Have yourselves a wonderful, spectacular day. We'll talk to y'all later, folks. Bye for now.